All right, here we are. Well, welcome. Thank you for joining me today. I'm really glad that you're here. We're going to dive into ending Lyme and tick-borne diseases through prevention. So today I'm going to walk us through the different ticks that we see in North America and the pathogens that they might carry so that you know what to look out for. And then we'll go through the top tick-borne diseases and the symptoms that they can cause, so you know what to look for if you had a tick bite from one of those ticks. And then we will move into looking at ways to prevent tick bites. And then what to do if you get a tick bite, steps to take after that, if that happens, after all your prevention. And then we'll move into covering some of the acute tick-borne disease treatment plans briefly for the time that we have today. So thank you so much for being here. I'm really passionate about prevention because as a naturopathic physician, I had been working in Vermont since 2010 and seemed to arrive there when I didn't quite realize I was on the front line of this epidemic. I trained with Dr. Richard Horowitz in New York, who's an incredible pioneer in this field, and I learned so much from him. And he actually said, "Oh, don't worry, there's lots of Lyme in Vermont." And I really didn't know that it would be such a big issue. So I'm glad that I was in southern Vermont and see people from all over New England and help them on their healing journeys regarding Lyme and tick-borne disease. And so over time, I also started talking about prevention because sometimes people would get well and they were back to having their lives back and getting out there and enjoying life again and going hiking in the beautiful area that we lived in there. And then they would come back with a tick bite. So I would, create this handout and give them lots of information about different tips on preventing the tick bites because I would see, unfortunately, people would get Lyme a second time, a third time. And that is what I really want to help prevent. Getting Lyme or tick-borne disease in the first place. So I'm glad you're here and you're interested in this information. I hope that this will be informative for you today. So here we are. Prevention is the best cure. This is one of the naturopathic principles. So without an effective vaccine, accurate testing, or a simple, effective treatment, we have none of those things. Each of us, I think, must do our part to educate ourselves and each other in order to stop the Lyme disease epidemic. So let's go through some of this information here that is pretty motivating. So in 2022, we just got the new numbers in, actually. Approximately 63,000 cases of Lyme disease were reported by the CDC. However, recent estimates using other methods suggest that there are actually 476,000 people diagnosed with Lyme each year in the United States. And 10 to 20% of these people diagnosed with Lyme continue to experience symptoms. So it is important for healthcare providers who are challenged by these growing numbers to learn more about Lyme and tick-borne disease and prevention. And I think also just for all of us, anyone, whether you're somebody who enjoys the outdoors as a leisure activity, whether you're a gardener or a hiker, or whether you walk across your front lawn in a Lyme endemic area, you are at risk for a tick bite. All right. So some other information. Studies show that Lyme disease costs about $1.3 billion annually in medical costs in the United States. Federal funding for tick-borne disease is less than any other disease. The NIH and CDC spend a total of $97,000 on each new surveillance case of HIV/AIDS and about $47,000 on each new case of hepatitis C, compared to about $1,000 on each new case of Lyme disease. So Lyme and tick-borne disease have a tremendous impact on our physical, mental, emotional, social, and economic health. So I'm glad you're here today to help me end Lyme and tick-borne disease through prevention. All right, so here we go. We're diving into the ticks in North America. So what are ticks? Ticks are actually arachnids. They are not insects. The hard ticks, called exuded, these have a dorsal shield that we'll look at later, while the soft-bodied ergacid ticks do not. So this will come up later when we talk about tick identification. Ticks are parasites, so therefore they depend on a host's blood for nutrition. So they need to attach to you or an animal to get that blood meal to then grow into the next phase. And so this is why this is such an issue, because they carry these pathogens. They are vectors. So a vector is an organism that transmits a pathogen like Borrelia burgdorferi, which is Lyme disease, from a reservoir to a host. So with that background, we have this list of ticks that we're going to talk about today. So we're going to go into great detail. There's a lot of Latin here, so don't let it intimidate you. I'll definitely reference the lay terms like black-legged tick. That's our number one problem in the United States and in North America. But so we're going to go through all of these ticks and the pathogens that they carry. So yes, this is the guy. This is the public enemy number one, the black-legged tick. So we're going to talk a lot about this tick and the pathogens it carries. The number one tick-borne disease in America being Lyme disease. So this Ixodes scapularis can carry Borrelia burgdorferi, as we said, which causes Lyme disease. Also, another cause of Lyme in the US is Borrelia mayeni. Now, this is out in the north central states. And then there's Borrelia miyamotoi, which causes tick-borne relapsing fever. And since it is a Borrelia, that genus, they create very similar symptoms to Lyme disease. We can also see Babesia, Anaplasma. Ehrlichia murus is out in the north central states, and Powassan virus. And then we see a map here. So you're going to see on each of these slides the map that shows us where these ticks are geographically in the United States, so that you know, you can pinpoint where you live on this map or where you might travel to, so that you're prepared to look for these ticks. Now we have a western black-legged tick, looks very much like the eastern black-legged tick. And so they're out on the West Coast. And they don't carry as many pathogens, but they do carry Borrelia burgdorferi, of course, that causes Lyme, Borrelia miyamotoi, Anaplasma, and Babesia duncani. So here we have these tiny ticks, right? So of course they are hard to find. And this is just to emphasize that point. The nymph is on the left, and then the female adult is on the right. We're going to talk about how to identify ticks. But first, we'll also see the unfed female tick compared to an engorged female tick. So some people, don't quite understand how big these ticks can get once they feed. They will attach to an animal and feed for 3 to 5 days, and then they fall off. And because they're full, they will not be moving, but they're still alive, and they'll be digesting that blood meal. So sometimes people find these on the ground because maybe it was on them or a dog that brought it in and they fall off. So they look like a little pea or something like that. And that's to say, yes, actually it must have fed on somebody. So that's important to note if it's looking like that. And you can also tell that the abdomen, the body, is pretty distorted there. It's pretty blown up. But if you look really close to the mouth parts, you'll see that little round black disc. That is the dorsal shield. That will stay the same. And that is how you will identify that tick, because other ticks will certainly blow up like that after a blood meal. But looking at that dorsal shield will be able to tell you whether that tick is a black-legged tick or a different type of tick. And then down below, we have that really scary egg mass, right? So that's where all the ticks are born. And then they develop through this life cycle that we'll talk about. So it's actually a 2-year life cycle that the black-legged tick has. So we've got the egg mass. They'll turn into larvae, They'll start crawling around. They won't have much energy, so they're going to be not moving too far to find a blood meal. So somebody who's close to the ground. So they need to stay in a humid area. So they'll be in leaf litter, really close to the ground, like that. And so often their first blood meal will be from a mouse. Could be a bird, a mouse, something small to the ground. Then they'll develop, they'll grow another pair of legs and become nymphs. So this is when we start to see them. They can attach to a human. They have a little more energy. They might start crawling up that piece of grass, looking for somebody passing by. So that nymph can carry pathogens at that point. So at the larval stage is when they attach to that mouse that they usually get Borrelia burgdorferi. We'll talk about that a little bit more later. And other pathogens. So now, since they might have pathogens as a nymph, they can transmit that to you. Now, these are very small. This is the size of a poppy seed. So they're very hard to find. So tick checks are so important, right? And prevention is so important because it's hard to find them. All right, so next, after the nymph, sometimes they winter over, and now we've got the blood meal that they will have. They will become adults. Now they are the size of an apple seed. The females have that nice reddish tan back that people do tend to see. And then the females will attach again to an animal because they will need to lay those eggs. And that's, again, where humans might be the host. All right, let's take a look at the seasonal activity. So since it's a two-year cycle, there's definitely overlap. There's overlap with those three stages. But a lot of people notice these bookends, especially in the Northeast, in the United States and North America. So we will have the bookends of the adults come out. So right now, in April, we're seeing a lot of adult female black-legged ticks who are looking for a meal so that they can lay those eggs. So that's that green part. So March, April, May. And then after that, we'll see the nymphs. So those are the smaller ones, the poppy seed size. So some people think, oh, maybe we don't have as many ticks. They're just smaller. So please look for them. Then after that, we have the larvae, the smallest, the size of a period at the end of a sentence. Of course, we don't tend to get many larval bites, but it is possible, especially if you're really down in leaf litter and close to the ground, it is possible to get those bites. So we get, I hate to say this, but we might get a little bit of a reprieve August and September. So still be vigilant because like I'm saying, and like this graph shows, there's overlap of all these different stages, right? But we do tend to see a little bit of a quieter season there during those 2 months. And then people tend to get surprised. They say, oh no, the ticks are out again. And they've always been there. But yes, we definitely see in October, November that the adults are out again and we can see them better. And they're definitely coming after humans. So something to be aware of. Okay, so now we're going to move on to the American dog tick. We're going to compare black-legged ticks to American dog ticks to other ticks. This tick actually in New England, we don't see that it carries pathogens very often. So that is a relief. However, again, I hesitate to say that because in other areas of the United States, they can carry Rickettsia rickettsii, which is the pathogen that causes Rocky Mountain spotted fever, and Francisella tularensis, which is the pathogen that causes tularemia. So it's really geographical. So just knowing about the prevalence in different areas is important. You know, is this tick carrying anything? And tick testing is super important too if you get a bite, which we're going to talk about later. So let's do a little bit more about tick identification. So of course we see, again, we're reminded at how small these ticks are. So we've got that in the hand there, the nymphs. And then just a little bit of a tick anatomy. The dorsal shield there I mentioned. So that's really close to the mouth parts. That solid round black area, which you see with the Ixodes scapularis. Now that is really nice to find because that will tell us that is a black-legged tick and make you aware that this tick might be carrying Lyme or other pathogens. Now compare that to the American dog tick next to them. Now you've got that kind of, it is harder, it's a little white, it's a little gray mottled scutum, not solid. So if you compare those two dorsal shields, that's the way to identify a tick. And of course, you do see that is a female black-legged tick there because we've got that nice little flag of the abdomen that's a reddish tan. And yes, that's helpful too. But like I said, that's the nymphs actually are just black. They're solid black. And if this female had engorged, it's not going to look that color anymore. So don't go by that way of identification. Look at the dorsal shield. Okay, now we have another one, another tick, Lone Star tick. So these are actually making their way up north into the area of New England more and more. So we are starting to see them in Vermont, New Hampshire, and Maine. They have already made their way to New York, to Connecticut, to Massachusetts. So it's an interesting time since a lot of my patients are in upper New England there. And then south of there, yes, from Texas up north, we see Lone Star ticks. So these are interesting because they have a whole host of other pathogens they might carry. So they don't carry what causes Lyme disease, but there is currently an unidentified pathogen, and there's a lot of conversation about this. And if we had more time, we could go into it. But there's something called star eye. Southern tick-acquired rash syndrome. And this is thought to maybe be caused by a Borrelia species, but not all researchers agree on whether that's true and what the name or what the identified pathogen actually is. But it can cause Lyme-like symptoms. So that's important. I think that's going to be something we're learning more and more about, hopefully get to the bottom of soon. But they can also carry Ehrlichia, Francisella, which causes tularemia, the Heartland virus, and the tick saliva in this tick can create an immune reaction. The alpha-gal sugar that they carry can cause something called alpha-gal syndrome. So some people have a reaction to that sugar in the tick saliva that then creates an allergic reaction in their bodies. So their immune system reacts in a very particular way. Not everybody does, but some people do. And the symptoms of that would be things like hives or anaphylaxis, which is a trouble breathing, like a throat closing, maybe itchy, swollen lips and mouth and tongue. So that's actually not a pathogen that's causing that. Like most of what we're talking today are tick-borne pathogens. But the alpha-gal syndrome is also very important to note because then what happens is people end up getting allergies to mammalian meat and products. So something to keep an eye out for too. And that can get better over time, but the only treatment is avoidance of those foods and products. So moving on to ticks, we're going to come back to talking about ticks and the brown dog tick. This is a tick that we don't see much of unless you have something like a kennel or a lot of dogs. If you're breeding dogs, you might deal with infestations of a brown dog tick. It rarely carries rickettsia, but it can, which causes Rocky Mountain spotted fever. And humans don't, it's uncommon for a human to get bitten, but it can happen. So, so it's something to be aware of, especially in these kinds of situations with dogs. And what can happen is it can be more of an indoor infestation opposed to the other ticks we're talking about are more of an outdoor issue. Of course, if you bring them in, they can survive for a day or two. And you need to be careful of that when pets are bringing in ticks. But this tick is a little different in that way where you can have actual indoor infestations. And now we have the Gulf Coast tick. So as you can see, this is more in the southern states in the United States. And this tick can carry Rickettsia parkeri, which causes a Rocky Mountain spotted fever-like disease, and Ehrlichia chafensis. And now we have the Rocky Mountain wood tick. This is a tick that's out in the West, as it sounds. Rickettsia francisella, causing tularemia, and Colorado tick virus are the pathogens that this tick can carry. And then we have Ornithodoros ticks. So this tick looks a little different, right? So no dorsal shield here to identify. This is an argacid tick, a soft tick. So they look a little different, and human hosting is incidental. So it can happen though. And this tick can carry Borrelia species. So these are the Borrelia that cause tick-borne relapsing fever, which is similar regarding symptoms that Lyme can cause. However, as it sounds, you can get these relapsing fevers. So a lot of times, like the places that you can find these ticks are in places like caves or old cabins, wood that they live in. If you're camping in a structure, they might be there and inadvertently come out at night. So they feed only at night, and they only attach for about 15 minutes. You won't even know it, and then they're gone, but they may have transmitted this pathogen. So these ticks are a little different in that way too. That's interesting. And they're more out west and a little bit in the south. And lastly, we've got the Asian longhorned tick. So this is just caution. We don't know where this is going. This tick arrived several years ago, or maybe now it's probably a decade or so, from Asia. And in Asia, it actually carries a lot of pathogens. So interestingly here, pathogens have not been found to cause diseases in humans after an Asian longhorned tick bite. So fingers crossed. We may not have to worry about this one, but there's just a lot of surveillance. There are some eastern states that have some distribution of this tick, but no known human disease yet. So